Okay, we're ready to go here. I'd like to call the February 21st meeting of the Human Services Committee to order. First order of business is to approve the minutes of January 17th. Do I have a motion to do that?
Move.
Mr. Landy motions.
Second.
Mr. Pavlock seconds. All in favor?
Aye.
Aye. Do we have anyone here for the privilege of the floor? Seeing no one, we will move to our first item on the agenda, which is the local law intro 3-24, a local law amending local law 13-22, providing for a management salary plan for county officers and employees regarding the coroner supervisor for the Department of Health.
Good evening, Mike Falk, County Chief Medical Officer, and relevant to this conversation, coroner supervisor, or coroner physician, rather. As most of you are aware, we've had long discussions in regards to our coroner program, the vulnerabilities there with turnover, the need for some foundational support, and namely a coroner supervisor. The coroner supervisor position was approved for the 2024 budget, and we have been working closely with our human resources partners and Debbie's team to put together a management salary plan for this position. And we are looking to get approval for a management salary plan of a range 5, which numbers-wise is $53,674 up to $82,248. Keep in mind that we allocated funding from a public health nurse position to fund this position. This was before we reduced the FTEs within the department by 4. So this is not adding on an extra FTE. This is a bachelor's level position, preferably, or at least 5 years of experience in nursing, law enforcement, EMS, or coroner experience. So we have budgeted somewhere along the lines, roughly in the $58,000 to $60,000 salary range for 2024. Obviously, we'll have some savings because this position, may not get filled until March or April, depending on how things go with the interview process. But that is really what we're looking here for today. Any questions or comments or anything I can help clarify?
Do you have anybody interested?
We have 6 coroners, and I think that there may be interest from a couple of them. Most all of them have full-time jobs, and they may not want to leave their other full-time job, but there may be interest. We're gonna hopefully post it, sometime soon, and see what kind of interest we get. I think that we have the potential to get a lot of very qualified candidates. And we will, vet those out. We will interview. I plan to have a sort of multidisciplinary interview process, including our law enforcement partners and our forensic investigation team, and those agencies which the coroner supervisor would work together with often. So, we will have the opportunity, I think, to take some time and consider some folks for the position. So. We may very well have, a qualified internal candidate, but we will see.
Any questions? Okay. And you're satisfied with the range?
Yep, I think it's perfectly acceptable. We're starting off kind of on the lower end, but there's, room later on, depending on how long this individual is here for, so.
All right. We don't vote on this, correct? Okay. Thank you. Number 2, proposed resolution to confirm appointments for the Chautauqua County Board of Health.
I'm going to speak on behalf of the county executive because technically these are County Executive Wendell's appointments to the Board of Health. There are 2 recommendations. Mr. Chairman, you are one of them. I am not going to share your resume because I don't have it in front of me. So I'll let you share that with your colleagues. But we appreciate your willingness to help out on the Board of Health.
My pleasure.
We do need, a legislator on the Board of Health according to our bylaws. So Mr. Proctor would be taking the place of Elizabeth Rankin. The second recommendation is Dawn Columbare. Dawn has a doctorate of nurse practitioner and an RN. Lives in Lakewood, New York. Will be filling an at-large position on the Board of Health. Dawn has been a nurse educator for a long time. She was a previous director of nursing and professor at JCC, is very active in the world of nurse education, and is very active in her community. And she was recommended by the county executive for an appointment on the Board of Health.
Well, I look forward to serving on it if accepted, and look forward to learning things. So,
Mr. Chairman, I can add to that, I believe. Dawn Columbare, as the doctor indicated, is very well qualified to serve. In her retirement, she is now very active, involved in community service in many respects. And we were very fortunate that she was willing to dedicate some of her time and talent to the Board of Health. That took a little convincing, but we were successful in getting that done, and we're very appreciative that she is willing to serve.
great.
Is her husband named Steve? I just want to make sure I'm talking about the
I'd only be able to reference her resume, and his name is not on it, so I'm not sure.
Yes, Phil it is.
same. Okay, then I know who she is.
Are there any other openings on the Board of Health?
I think we may have one seat on the Board of Health available as a representative from Dunkirk, City of Dunkirk. I'd have to double check, but that seat was vacated this past year, and I don't think we have yet refilled that seat. So each city in the county, we have representation. There's my understanding that we're lacking a seat from Dunkirk. So,
Okay.
if you know of anybody.
All right. So,
Thank you.
any other questions? All in favor?
Aye.
Aye. Number 3, the proposed resolution to amend the 2023 budget for year-end reconciliations, Veterans Service Agency. And we do have an amended copy on the desk.
Good afternoon. The resolution
If
is,
you-
sorry.
Could you identify yourself?
Oh,
just
sorry.
for-
Greg Carlson, Director of Veteran Services for Chautauqua County. For the resolution, is an increase to the use of fund balance of $2,960. This is primarily due to an increase in the appropriation accounts for employee benefits, which was due to changes in benefit election. And they were able to decrease appropriations for personal services, equipment and contractual, and also a little bit of revenue from transportation income, which gets you to the math of $2,960 for an increase to the fund balance.
And that's the amended.
Correct. And that's it, unless there's questions.
Any questions, comments, concerns? Okay. Do we have a motion to amend the original resolution?
I'll make a motion to amend the original resolution.
Okay. Do we have a second?
Second.
Okay. All in favor of amending the resolution?
Aye.
Aye. All in favor of the amended resolution?
Aye.
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 Okay.
Okay, thank you.
Thank you.
Yep.
You did that right? Yeah. Number 4, proposed resolution to amend the 2023 budget for year-end reconciliations for public health.
Good evening, Sam Zafuto, Deputy Director of Finance. This resolution is to balance the accounts through public health. They're primarily overages in personal services and benefits, and it's being balanced through the savings, through the vacancies we had in public health. So it's overages and benefits in the coroners, from payroll allocations in our education for handicapped children and early intervention. And then we had an overage in the equipment line, which was the mobile health unit that was purchased. All of this is being balanced with a savings in the personal services under public health admin.
Okay. Any questions?
I have a question.
Sure.
Mr. Chairman. You were able to balance within the departments. How much extra is left in the
Just
personal
off the
services?
top of my head, there's
Yeah.
over $500,000 left in the public
Sure.
health admin.
You know, so, a lot of savings that we've had.
Yep.
Savings because we just don't have the people in the positions filled, correct?
Yep, that is correct.
And how many positions is that roughly, Sam, do you know?
In health, I think it's 8 or 10, I think, but it's been through the whole year of the
Yep.
vacancies, so there's been different spots. Off the top of my head, I don't have the current number. It's been reduced now. They've done a pretty good job of filling positions through public health.
Moving forward into this coming year, do you think our estimates of our vacancy savings will be accurate?
Currently, yes, at least for the public health side, because we still are working some overtime, but at this time we're above hours, but it's not as pervasive. And they're doing a pretty good job of actually filling positions. So I'm not overly concerned about the savings book currently in the health department.
Okay. Thank you.
Why are we doing a good job of filling them? Is there a specific reason, or, you know? just-
That, because I'm not really involved in the
Yeah.
HR side of it up there. I just know the vacancy report for health is significantly smaller than the one I see for DSS.
It's good. It's good we're getting the people. Any other questions? Comments, concerns? Okay, all in favor?
Aye.
Aye. Number 5, to amend the 2023 budget for the year-end reconciliations, Department of Mental Hygiene and Social Services, and you also have an amended copy on the desk.
Yes.
Okay.
Well, thank you. Yep, I do apologize for the amendment. We actually received last week the information for the 2022 rates and chargeback for youths that were in state custody. That amended our accrual. We had initially had thought, as we went into 22 for the accruals, that our rates were going to significantly go higher. So we had booked a $2,000 rate for 2022. Last week, we got the official rate of like $1,532. So that reduced what we had, that reduced the need for local share ask. So we did amend that last week as we got the confirmation and actual chargebacks and rates from OCFS. The rest of the resolution itself, there is a pretty large overage under social services admin. That is kind of mostly made up between two programs, Code Blue and our rental supplemental program, which are not paid through the state system, but are paid through our New World software. We had a budget of like $225,000 and allocation of almost $1 million in those accounts. So that's why you're seeing an overage under social service roles. Daycare, obviously, there's been increased eligibility, there's been increased absences. With the increased, basically those increases, we're seeing increased costs and increased revenue. Service for recipients, family assistance, foster care, obviously the case numbers are going up, the expenses are going up. Safety net, we've already been here and discussed a couple months back. Unfortunately, this is a need for an additional request for safety net. There is additional revenue that's also offsetting this. And then the Medicaid weekly shares, at one point, we had quite a large savings for the Medicaid weekly, so we had moved some money to balance some accounts, and then since then, the state had changed the savings we were gonna have in the weekly rates. So that is my fault. I had used some of that money that I should not have earlier in this year. And then there's some overages at the Youth Bureau that we're kind of balancing through the rest of this. At the end, there is a need for local share of $297,206 for social services for year end.
Any questions? You're thinking, Dan.
Sure, I have a question. So, you know, obviously, we have, would you say that the overages are due to a more of a need from the community and, you know, just kind of an
Yes.
unexpected need or more than what we anticipated?
Going into 2023, yes, everything we've seen, the case numbers are up, all the reports are up. So every driver we're seeing is going to have increased costs. In some cases, like, we just didn't have a proper budget in for Code Blue, or I'm assuming we were meant to amend that under social services admin, because the budget doesn't jive with what the actual programs were that are under there. So, but no, we've definitely seen all of our numbers up as we discussed through the budget hearings, and that continues to this date.
I mean, that was the case with Safety Net, correct? I mean, that's exactly what it was. Okay, any other questions? So we have an amended copy here. I will need a motion to amend the original resolution.
So moved.
Jamie, is there a second?
I'll second.
All in favor of the amended resolution, or all in favor of amending the resolution?
Aye.
Aye. Okay, all in favor of the amended resolution?
Aye.
Aye. Okay,
All right, thank you.
thank you. Proposed resolution number 6 is to amend the 2024 budget to implement the Women's Shelter Project within the Chautauqua County American Rescue Plan Act, ARPA spending plan.
Carmelo Hernandez, Commissioner of Social Services and Mental Hygiene.
John Anderson, Deputy Commissioner, Social Services.
So this resolution is requesting consideration for the use of ARPA funds to support the implementation of a women's shelter in the city of Jamestown. The request is for $100,000.
Okay.
We can definitely answer any questions you have. We can describe the project in as much detail as you want. But in general, this is a project, as you may or may not know, there's not a lot of shelters in Chautauqua County at this point. This is this initiative here is funded in multiple ways, but it would provide for 14 rooms for single women, and there's 2 rooms that would house 2 women. So between that, that's 16 units of services for women who need shelter. The program, the project itself is almost $3 million, and this is $100,000 of that $300,000. I have all the details here. $2.5 million is through OTDA, which is New York State Office of Temporary and Disability Assistance. It's the HHAP program, Homeless Housing Assistance Program. $110,000 is City of Jamestown Community Development Block Grant for lead remediation for the building where they're locating this, which is at 303 Lafayette Street. $100,000 Chautauqua Region Community Foundation, $624,000 Homeless Housing Assistance Corporation, and then there are some miscellaneous other pieces of funding that they're still seeking. And of course, any funding through this resource would be contingent on them securing that other funding.
So if we do secure the other funding, we may not need this.
Well, we would need this, but we would not provide this funding if for some reason that project were not to go forward.
Oh, well,
Yeah, that would be the exception.
So, John, is there any housing for families and children or just single women?
One of the projects that UCAN Mission was working on previously is one that was listed in the original description of the program. And unfortunately, they purchased a building it's on Main Street. And that building unfortunately had lead issues, not lead issues, was it lead issues? Asbestos issues, sorry about that. So they did not progress with that project, and the state and federal dollars that they were applying for, I don't believe were ever came to fruition. I did have a conversation with Sharon, with the new president of the board there, probably about 2 months ago, and they are going to do a pilot, women and family shelter, in Jamestown. They haven't gotten that off the ground yet. They're right now still dealing with some issues at the men's shelter.
Is that Sharon Hamilton?
Yes, thank you.
Thank you.
And
You're
this
welcome.
has been,
But it is needed, by the way, families.
this has been approved through the ARPA committee.
Mr. Chairman, I'd just like to highlight what John indicated. This project is one of the initial ARPA projects. And it has taken a couple of turns as the struggles to establish a shelter in the city of Jamestown, as John indicated, has changed. So this is the latest version of this project, which finally is coming to fruition, so we
Yes.
can allocate the money to it.
Yeah, thank you.
So, I'm sorry, Mr. Chairman. The ARPA money has to be spent by
Yes.
the end of 26?
June.
End of '26.
Yeah,
Has to
26.
be appropriated by the end of this year.
Right.
Yeah, so the plan would include that would be done by the end of the year. And actually, the shelter should be complete by the end of the year as well.
Good.
Yep.
Thank you.
Which is great because it's 16 spots for women. And right now, that's we're in a hard situation with shelter for
Yeah.
women and men.
So there's like a waiting list to get into this?
Right now, we have, the UCAN men's shelter is closed because they are doing asbestos remediation. They also have some other issues that are being paid for by New York State Office of Temporary and Disability Assistance so that they can reopen. There's not a women's shelter, and there's one more I'm missing right now. UCAN, the women's shelter. But right now, we are limited just to hotel placements, and that is really creating a burden on the system and people.
Dan, you had a?
Yeah. What agency is opening this place?
Chautauqua Opportunities.
Chautauqua Opportunities.
Mhm.
Okay. And currently, like, down the hall of, we're have a place now for women. How much of the need is going to be filled? I mean, are we going to cover half of the need?
No.
Or a third?
No, in fact, prior to, back in 2020, maybe even 19, the talk of shelter development in Jamestown and Chautauqua County was just starting to get underway. The UCAN men's shelter just opened right around that time frame. There was nothing for women. And I do recall having phone calls with New York State when there were discussions about establishing a women's shelter in Jamestown, that having this agency and UCAN applying at the same time to the state for funding there wouldn't be capacity. But even back then, 2 or 3 years ago, the both of them together would have not met all of the capacity. So we still have a need for more, for sure.
And
There's
the
no
need's
doubt.
increasing.
And the need is definitely increasing, yes. Yeah.
Did they consider, I mean, obviously, there's been a lot of research or whatever done,
Yeah.
but is this building expandable?
This building is not expandable. They did do an extensive search all over the county for space or for land, property.
Yeah.
And that started in Dunkirk, actually, because it would have been an opportunity to put something in the North County. They had trouble finding a space, and this building happened to come open. And I think even though at that time when they were looking at this building, it might have been more realistic to be looking at 16, but it's definitely spiraled, the number of homeless women and men.
Let's have that positive outlook. This
Yes.
is great news.
It is great
And
news.
we
Yeah,
have
it is.
villainous, and that's, I guess, what the level of emphasis, and hopefully, it's a pilot, right?
Yeah.
And we can say, hey, this is really working well. The agency, Chautauqua Opportunities has done well here. Let's expand it if it's possible, right? And so this is
Yeah.
good to, at least now we have some new beds available, and they will be filled, I'm sure, so.
They will be filled and they will have services on site for the ladies that are there. Yeah.
Yeah, it's very positive news. And you expect it to be done by
By the end of 24 is what I've been told. They should be done by that date. They better be.
Now, are they supervised, or these women just go in and live by themselves?
No, they are supervised. There will be staff there 24 hours a day.
Mr. Chairman, I can elaborate a little bit on this, that the need is extensive. And within the last year, there was a women's shelter proposed, and it is going to go into a vacant building. It was ideally positioned for a women's shelter, but it required a zoning variance from the community. And the neighbors and the community members were very much opposed to a women's shelter being placed in their community. And so the municipality turned the zoning variance down and the project died.
Yeah. Very unfortunate.
It's unfortunate when you think that communities do not always embrace the placement of a shelter in their neighborhood.
It is.
Is that in Jamestown?
Not in Jamestown, just outside of Jamestown.
That is very unfortunate. It's a reality, though, unfortunately.
It's sad when there's a need in the community for any sort of program or building or service, but nobody wants to house it. you know.
Right.
And, and I'm sure that, you know, one hurdle, that, it shouldn't be a hurdle that you have to overcome. But,
Yeah.
just as Sheriff Quattrone is trying to get himself a position here or a place for releasees to be able to go, but nobody wants it in the community.
Well, we did that.
Well,
We passed that, public safety.
well, you know, and geez Louise, so, what an uphill battle though to finally find them. And this is no different, so,
We're fortunate that there's an agency that's willing to do the work as well.
Yes.
It's hard to get that.
Yeah.
And that's your tackle opportunity.
That is, yeah.
Now, is that 24/7 staff that's
Yeah.
gonna be there? Is that already budgeted too?
That's part of their project, yeah. That would be part of their ongoing budget. The funding that I mentioned is all capital funds to establish the facility. So they would have a separate operating budget and they would have funding coming from various sources for their operating plan. But the state would not be releasing those funds, the capital dollars, if they didn't have a plan for ongoing funding to sustain it.
Okay. Well, hopefully, thank you for all the work you've done on this, and
Well, thank you for your consideration. We appreciate it.
as Mr. Pavlik said, this is hopefully just the beginning, so.
Thank you.
Any other questions? All in favor?
Aye.
aye.
All right,
Thank you.
thank you very much. Now, now we have a discussion on the agenda on the Child Protection Services. I'd ask Carmelo to come and explain. We had a couple of people at our legislature meeting speak to the privilege of the floor. There were some concerns, and I just wanted to try and figure all that out, so.
Oh, yeah, no worries. So, most definitely concerns. I would say the two biggest ones are training and workforce in the sense of lack thereof. So the first thing that we got to look at is in the short term. So we had recently 3 applicants declined the position, and one of the reasons was because it wasn't 40 hours, and they could go, I believe it was Home Depot, and part-time was considered like 37 or around there, 37 and a half, or along those lines, and this is recent. The other piece, when it comes to workforce as well, is training. So one of the things that is mandated is got to spend 6 months in Albany conducting training, and then most of the training, I don't want to call it fluff, but it is fluff because they say well, your county's gonna tell you how it is that you gotta run it and run the program or conduct it. So basically, employees are going for these 6 months, and then coming back and having to relearn everything once again. And then we also gotta look at the demographics when it comes to Dunkirk and Jamestown. And Dunkirk is more spread out. The workers there are more seasoned. They've been in the field a lot longer. Jamestown, they're a lot newer, but Jamestown is the city that has, I don't want to say the more high-risk cases because the high risk come on both sides, but it's complex. It's very similar to what we would see in the Bronx, New York. Is very different than what we would see in New Rochelle. Even though we may have one or two that look the same, but it's just the constant turnover of the cases, same families too, repeated, and it becomes overwhelming for the workers as well. So the immediate is working with Sam and working with the team on proposing a 40-hour work week schedule. 62% of that is reimbursed by the state. We have approximately 11 contracts right now, community contracts that are out, that we're looking at our resources and how to keep those contracts going, but also most importantly, our resources and our infrastructure that we most definitely have to focus on and building it. That's going to be huge in terms of assisting with that 40-hour work week for whoever opts into that piece. I would say the other piece, I just spoke with Lori Dose, who is one of our managers, and she's creating a plan, and it should be done by this Friday, on basically having the casework look standard operating procedure on both sides of the county when it comes to the caseworkers, and also creating a plan in the sense of having staff from Dunkirk be able to assist in Jamestown to bring down some of those cases, because quite a few of them are out there. And one of the things that I've most definitely heard and it was planted in my head is what the workers of Jamestown and all the workers in Dunkirk as well have stated. Their biggest fear is going home and unfortunately a child ending up being deceased and being overworked because you're trying to stick to the 35 hours and you're trying. So we're really manipulating that and trying to work with it and while still complying with state labor laws and things of that nature. So it's a multifaceted, I would say the biggest hurdle, but it's a hurdle that I'm willing to attack is training. John brought up a great point today. He said instead of county, maybe we should try a regional effect because it's mandated for us to have to send the workers to Albany, which kind of defeats their purpose because they're still having to come back and be retrained here anyway by the more seasoned staff. So it's causing, I'll admit it, burnout because you have the more seasoned staff being pulled out and trying to help the newer staff, and we have a lot of new staff in Jamestown. So most definitely the 40 hours, the contracts and the resources and allocating them. Those are the two big ones, and we're looking at also program coordinator as I mentioned it, to oversee our contracts and make sure that the resources are going in the right direction and be able to use the position in a multifaceted way, but most importantly is build our infrastructure and child welfare.
Okay. Any questions?
How many vacancies do you have in Jamestown?
I believe right now, in Jamestown there's 5.
And what's your,
Dunkirk is full, Jamestown is 5.
okay, and if you were fully staffed, how many would you have?
Fully staffed will have 38,
Okay.
And
because there's 32 right now.
these are just caseworkers?
Is that enough?
Honestly, it depends. I would say, in my opinion, I would say no, in my opinion. But I would also say we need to get to homeostasis to be able to assess. But I will say that the cases that are coming in, and some of them are repeat, some of them are 1 kid, 2 kid, maybe 5 kids in the same household. So you got to open the case for all the children. So that just becomes, even though you're working in one house, but that's like 5 kids that you have to assess and then work with the families and work with the parents. So it could become really quickly, you could get overwhelmed. And then we have to run 24/7.
And your caseworkers don't work 40 hours? I'm a little cloudy on that.
35 right now.
That's it.
Yeah.
Why is that?
We would approve the 40 when, like, on a as needed basis, but in approving that and then having the conversations and then meeting with the staff, not even just the supervisors, even though the supervisors and the managers as well have advocated and acknowledged, I don't think for just the nature of where we are post, I hate to say the word, post-COVID, I don't think 35 is enough. I'll be honest with you, I don't know if 40 is enough.
Are they hourly or salary?
Hourly.
So is it a budget? Is it a budget thing that we're facing?
Yeah, oh, most definitely, most definitely. And that's one of the things that as I came into this role on the DSS side, that we have opened up the closets and have uncovered a lot of things budgetarily that we most definitely need to fix. So I'll give you a perfect example. Once we I don't want to say reallocate, but readjust these contracts, these 11 contracts, I mean, it's very likely that could cover the 40 hours and new staff, and we'll have no problems there. And it's a good possibility it may not. There would be another conversation. But I will say there are contracts that we are looking at, but most importantly, I'm glad we're getting reimbursed at 62%. But that's one of the reasons I'm going to NISAC this time around as well, is to look for the child welfare and say, why can't we get reimbursed at 100%? I mean, mental hygiene covers 100% of the 730, so why can't we get that on the back end on the... To me, it just makes sense, but
Do you think your existing employees would work 40 hours?
I think we have quite a few that would opt in. Personally, I do. I think all of Jamestown would, and I think some may, because I've heard it on both ends of the county. Some people asking, can they come in a little bit earlier just to catch up, make sure they catch up on their notes, and it's just easier. And I understand it because there's times where I show up to the office early, just because there's no noise, no phones are ringing. So I get it from that perspective also. But it also, I mean, I could just say it, not being a commissioner or a leader or any of that nature, going into a home, you see the home in the status that it is, you see the child, and then to go home and try to rest and try to be with your family, knowing the status of that case and knowing the fear. It's the fear of the oh my God, what if, and that what if could keep you up for years.
If you go from 35 to 40 hours a week with that many employees, it'd be like adding 4 new employees, right? So
Hopefully.
Just that adjusting, just time-wise.
Yeah.
You know, now you got,
At 35 hours, do they get benefits?
Yes,
Okay.
yes.
I thought maybe that's why they're keeping.
No.
Instead of part-time, you don't get benefits.
Yeah, because you said some applicants went to Home Depot because there wasn't 40 hours.
Yes, we had 3 recently that applied at Jamestown, did the whole interview process, and when they found out it was 35 hours, they turned it down.
Qualified good, you
Mhm.
would want them if they wanted.
Do you have much of a turnover?
Oh yes, there is. It's not an easy job as well. What we're hoping is with this extra 5 hours that it also would allow some time for training, because they're having to be retrained by us anyway, and hopefully that will help with retention as well, because the amount of money that is spent on the training. So we're talking about worker 6 months doing this training every 2 weeks. They're out in Albany for however many days, and then after their 6 months, I don't want to say they get fluff cases, but we try to give them some just to get their feet wet. But the cases sometimes come in and sometimes so detrimental, and the workforce is the way it is. Now they're having to deal with these tough cases, so it's like I can't deal with this. And some of it is support, some of it is training, some of it is just having that person that you can lean on, and the time to train as well, right? So we're hoping that these 5 hours not only allow a little bit of, I'm not going to say it's going to cover the whole peace of mind for the caseworkers, but allows a little bit of peace of mind, like I'm catching up on my work, but it also allows that time to say, hey, let's sit down, let's go over your notes. Oh, hey, I'll go to this home with you from the more senior worker.
And Dunkirk's pretty good, Jamestown not so much.
Jamestown has, I want to say, more of the newer workers. I think that's one of the reasons. Jamestown is Dunkirk is fully staffed, and I think the average worker there is over 10 years. I think the newest worker has been in 2 years. So
What's Jamestown average?
Jamestown's, I think the average is a year. The more senior worker, because they had some retirements, 20 plus years for the case supervisor, for the B supervisor, another 10 plus years for the other B supervisor, and I want to say maybe one or two over 10. The rest is literally a year, 2 years.
So you don't have much of a turnover in Dunkirk, but you do in Jamestown.
A lot of that, I believe, could be because one of the things, the way I look at Jamestown is like an inner city, even though it's Jamestown and it's in Chautauqua County. So it's kind of like the amount that just could continue to roll out of there, and or the severity too. That could be it. So I don't know the data off the top of my head or the average, but let's say in Dunkirk, if you have maybe 5 that were like, holy smokes, Jamestown may see 8 holy smokes that week, or maybe 9. And it's I think it's just the nature of the inner city. A lot of the poverty, a lot of the homelessness, fentanyl. I mean, even though it's all over the county, Dunkirk seems more spread out. The north just seems more spread out, and Jamestown just feels like they're all neighbors.
What about the rural areas? I mean,
Oh, we get some cases out there as well.
well, I know you do,
Yeah.
but they're covered fairly well. They, depending on where they are, north or south, it's.
hmm
What is it we need to look at as a legislature?
It's a great question. I wasn't expecting that one. I would most definitely say support anything we could do at the state level for the trainings, and support in terms of the 40 hours when it comes up. Even though we're going to do our due diligence to be fiscally responsible, to not make it a big burden and have a win-win. And also just being aware that when it does come to these contracts that we are looking at and we are reassessing and we are adjusting, that it's not us trying to take away from anywhere, it's us trying to do the right thing all the way around. And one of the biggest things is looking at our staff who are, for lack of a better term, behind enemy lines. And I see them as the first responder in this line of work that sees the ugly that the world has to offer.
It's gotta be very difficult. I mean, can't even imagine.
Chairman, I just want to say one thing. Carmela, as you're working on, your plan for 40 hours, just make sure that you speak to the cost savings for retention of an employee.
Yes.
And that's just, it's paramount, right? So it costs so much money to bring in an employee and to train them and to lose them. So even though we're talking about 5 hours per employee, we're talking about so much more than that, because
Yes.
if you're able to retain those employees,
Yes.
the cost savings is immense. So I'm sure you will, but I just want to make sure that.
Most definitely.
The 6 months training in Albany is mandated by the state.
Yes.
And it doesn't do any good?
It doesn't really, from what I've been told by staff that have recently gone to Albany, it doesn't give them the necessary tools to come in and hit the ground running. It's fluff.
Are they aware of that up there? It's not
They're aware, but they don't do anything.
Very aware.
But no chances of.
The state did invest quite a lot of money in a training center in Albany. So there was a hefty investment by the state in that project. So I think there are others who would agree that a regional approach of some sort, even if it were in some small measure put in place that was regional to mitigate some of that distance. For us here, it's probably about the furthest of anybody in the state to send our employees, and 6 months' time is quite a long time. If you're a new, younger person, you have a family with young children, imagine committing yourself to traveling to Albany all of a sudden, and that's part of it. And I think I've heard Gib Taylor from probation talk about some of the requirements that they're facing now too. But it's a big lift for people to, I'm going to take a job, I have to go away to training, it's in Albany, I have to have somebody at home that's going to support this. So it's a lot. And Carmelo is right. Once you leave that, once you're trained, but you still have to do the hands-on, boots on the ground work in order to see what really is going on and have some supervision, and then you're trained after about a year. You can start doing some of the more intensive work. So it's a big lift for the newer employees and for everybody else around them that have been there longer to maintain and help us mitigate liability for some of the more difficult cases.
Has there been any lobbying to have that via WebEx or remote training?
Some aspects of it are, but they still want us to go. They want the staff to go there. It would be something that would need to be brought up at the state level with New York State Office of Child and Family Services.
They want to utilize that new training center that they.
Yeah, I think, Corey, do you remember how many years we've had the training center in Albany? Has it been 6, 7 years?
7 years.
Okay. Yeah. So yeah, they did make a big investment.
So has anybody ever got hired but couldn't make that commitment to go to Albany for 6 months and say, I can't do this?
I can't say that I specifically am aware of that, but I do think that I've heard that that has happened to us.
That's a pretty heavy commitment to be able to,
Yeah.
especially if you have a family or something.
And the cost of getting them there and housing them
Yes.
there falls on the county.
There's some state funding for that and some county funding for that, yes.
So as Jamie said, just so they don't have to keep going, hire somebody, have them go through
Retain.
training, and then have them leave, and then have to pay somebody
Right.
else to do that.
It's a big investment.
Huge.
Yeah.
And only get them 35 hours a week too.
And then you said the average in Jamestown is a year or so, which is basically, they just got through training and
Yes,
Yeah.
now they're,
yes.
Right.
Another big piece of that is while they're going through their training, I believe they can't even touch a case. So they're sitting at a desk going through the training. So they really don't know yet what the work entails. And then once you start going out there, it's like, oh man, and and it's a big investment.
so of the 32 people we have now, how many are in training actually, and how many are actually doing casework?
I believe 2 are still in training, and the rest are doing casework.
So the lion's share are doing
Mhm.
casework. I mean, that's good, I guess, but if you're fortunate enough to hire 6 more people, they're nothing for a year.
Pretty much, yes. That's why the 40 hours as well.
Yeah,
I'm always a big picture person. How do we help it in other areas? In a sense, how do we limit the need for child protective services, right? So how do we, combat it in a different way, in sense that, how can we help these families or help these situations before they turn into a child protective case? Okay.
I would say a lot of it is related to other services that exist in the community, schools, what's happening in schools, mental health services, drug and alcohol services, starting with early intervention programs and supporting those for early childhood, pre-K programs, all of those things that are going to help with kids and with families and keeping them together.
You look at this, and you say, how do we help the child protective services cases? Well, another way you can help, instead of just hiring people or changing hours, is putting into some of these other programs, and then they don't turn into a child protective case,
Yeah.
right? And so you take the burden off different ways, and so that's, I'm sure there's areas there that could help
Yes.
offset that.
Yeah.
And, combating our, you said fentanyl issues and stuff, combating that and trying to help that, in the sense that I'm sure that's gonna help alleviate some casework, in the long run.
Most definitely.
So when they go to that 6-month training, not once in that 6 months do they actually go out in the field and work with hands-on case, or work with someone on a case?
They'd be shadowing with a more experienced worker,
They would do that in
Yeah,
6 months.
but they wouldn't have their own caseload.
wow. Anything else? Thank you.
Thank
It's,
you.
Thank you.
A lot of work to be done and very important.
Thank you.
All right, is there any other? Seeing none? Do you have a motion to adjourn?
I'll make a motion to adjourn.
I'll second it.
Second, all in favor?
Aye.
Aye.
Aye, we are adjourned. Thank you. That's, that was a good discussion.